Time now for News Talk. Dr. Timothy Pfister's live in studio. He'll answer your dental questions. The number to call, 315-793-WKTV. And before we get to calls, we'll talk a little bit about, you brought along a couple of examples, and we also have some pictures of dental implants. And now, dental implants can be very expensive, but there are alternatives, and there are ways to get around the expense of certain things. So let's talk about that.
Yes, well, Jason, there are a number of ways of restoring implants. One is a fixed bridge, and this is called a high bridge. It's sort of a compromise or a hybrid type of appliance. On the left side of the screen they're shown where the prosthesis is fixed onto the implants with screws. It's not like a bridge, but it's sort of like they call it a hybrid. Another solution, which is a little less costly for folks, if they have a denture, that denture can be either remade, or sometimes if the denture is not that old, we can fixate that denture down onto the ridge with attachments that you can see on the right side of the screen there, that there's little locator or even O-rings that will fit over top of those implants and allow it to be more secure. So there's a lot of different solutions for restoring implants, but these are two of the basic ones, yes.
Now, obviously, you hope that someone doesn't have to go to a situation like this, but if they've already gone to this makes it easy. We want to make sure, though, that we don't get to that, and that, of course, it's dental care early. And, you know, kids are going off to school now.
Yes.
Kindergartners off to school, they've already should be working on their dental hygiene. But even the youngsters, like, what, maybe a year, 2 years old, you should already be starting dental care for your little ones, right?
Absolutely, because, Jason, the more the patient becomes acclimated to coming into the office with mom and dad maybe, the more they can be, you know, used to that atmosphere, and they can get comfortable. And that's so very important, especially when the parents are supportive of that, and they allow the patient to come in, the little one that they have, to come in and become, you know, part of the family, so to speak, of the dental group there.
Let's talk about infants, because there are a lot of folks that obviously, well, you can't put a toothbrush with toothpaste into a baby's mouth. They're not going to rinse and spit. But there are ways around that. So let's talk about that, because there are a lot of folks at home that go, I'm not dealing with that.
Yes. At the drugstore, if a parent can go to the drugstore, and there's things like, look like little finger cots. They almost look like a little toothbrush, but it goes right over top of your finger.
And they're inexpensive,
And they're inexpensive, and it's a good way to introduce the patient to really keep their mouth clean. And so that we can, you know, encourage patients to be proactive in helping with their children like that. That's very important. And to come in early so that they're able to be seen. We
do have a couple of calls on the line. First up is Michael. Michael, what's your question this noon?
Yeah, my question is, first of all, good afternoon.
Good afternoon.
My first question is, I wanted to know if my wife and I are on a fixed income, and we were just wondering if is there any dentists around that would take a payment plan from you?
Well, there are dentists. You have to call each office specifically, because we at our office, we offer something called a membership program. And for folks that don't have insurances, we've tried to create this plan so that they can get, in a way, discount dentistry or some kind of a discount off the fee structure that we have to allow them to make their treatment more affordable. So there's offices that try to be creative like that in helping people. And so you just have to call around. You're welcome to call our office and look at our plan, but there's alternatives out there that can be very affordable for you.
Thanks for that call, 315-793-WKTV. I believe we have Sarah on the line. Sarah, go ahead.
Yes, I am calling because I have a question about my mom. She has a lot of failing teeth. She has a lot of gum issues in the past, and how can I find out more about this?
Well, you know what you're talking about there, Sarah. It could be very well a solution for implants. If your mom has failing teeth, and the old way of thinking was to keep the teeth as long as possible, but if there's failing teeth and you know down the road that the prognosis is not going to be that great, it's better to take the teeth out, keep the amount of bone, maybe even graft it. We offer at our office a free consultation with a CBTC scan, which is basically a 3D image of the bone. And we can evaluate your mom, have her come in, make an appointment for the office. We can evaluate the quality of the bone, the quantity of the bone, how those teeth would relate to implants if they could be placed. So if you come in, we can evaluate and see if your mom is even a candidate for implants.
All right.
That would be a nice alternative.
And thanks for those calls. Always good to see you, Doc. Thanks for coming.